Hello and welcome to the part 2 of diabetes mellitus. If you haven't watched the part 1, I'd strongly encourage you do that before watching the part 2. In the part 1, we've already laid the foundation for what diabetes is, different types of diabetes, symptoms, risk factors. I strongly advise you watch that before watching this. In this part 2, we'll be looking at the treatment, complications, prevention of diabetes, and then I will touch on some of the videos I possibly would also get done subsequently. So in terms of, well, just a quick recap. We've said that diabetes could be diabetes mellitus, diabetes insipidus, but we've paid attention to diabetes mellitus. Both diabetes insipidus and diabetes mellitus will cause polyuria, which is a form of passage of excessive amounts of urine, but the mechanisms by which the polyuria occurs in diabetes mellitus and insipidus are quite different. Now, in terms of types, we talked about type 1, type 2, gestational diabetes, maturity onset diabetes of the young. We're not focusing on the last two, we're rather focusing on the first two. And then we talked about the risk factors, the symptoms. Remember, I mentioned 3 Ps, which would be polyuria, polydipsia, polyphagia with weight loss. If you remember these, you most likely will be able to diagnose diabetes even in the absence of a doctor, possibly. In terms of the treatment, it's usually a multidisciplinary approach. What that means is that you require a number of people in different aspects of medicine to bring their knowledge to bear in managing the condition. So, multidisciplinary approach. And these will require the expertise of a general practitioner, endocrinologist, physician, podiatrist if the feet are quite significantly involved, ophthalmologist if the eyes are quite involved, diabetic nurse, dietitian, and then depending on the organ really that is affected, these different people can be brought into the management of this patient. Now, of course, it also depends on where you live in terms of the country you live. That will also determine who's looking after you. But very important to mention that the specialist that is trained in this management particularly will be the endocrinologist. So if other specialties are having challenges addressing the situation, the endocrinologist is the specialist that is trained in the management of diabetes. And so the cornerstone of management of diabetes will be patient education. It's important to have a very strong knowledge of what is going on in terms of management of this condition and the basic pathology, what's going on. The patient needs to know. And that explanation is crucial to help the person understand that this is a chronic condition, will require medications, will require lifestyle modification, and then to understand the symptoms of the treatment in terms of hypoglycemia. Now, in diabetes mellitus, we're talking about hyperglycemia, which means excessive or high amount of glucose or sugar in blood. But in trying to bring this glucose down, the medications or the treatment can also bring the glucose too low. So you have hyper, and then the treatment becomes hypo, which is too low glucose. In other words, glucose that's too low in blood. And this can present with its own symptoms. I will do a video on that. And then important to help the patient understand the need for compliance, because without compliance, complications will set in and can be really, really debilitating. It's also important to reassure the patient that despite this situation, it's important to know that there are medications that can significantly help in the management. The treatment will depend on the type, and we've discussed how to make the diagnosis in part 1, type 1, and then type 2. If it's the type 1, clearly the patient will need insulin. If it's type 2, the patient will require lifestyle modification. Now, sometimes for the type 2, lifestyle modification, in other words, exercise, a proper diet, may be adequate to control the disease. But if these fail, then it's important to introduce medications. I'm not going to go through the medications that are used, but there are quite a number of medications that could be used. And then sometimes patients that are type 2 may also require insulin. The aim of treatment is what is referred to as achieving a tight glycemic control. In other words, being able to maintain normal glucose level so as to prevent progression of disease and complications that will set in. In addition to medications, lifestyle, Sometimes patients may also benefit, or patients could benefit from transplanting the pancreas. Now remember, I mentioned the pancreas as a gland that produces insulin by the beta cells of the islet of Langerhans. If you carry the pancreas and transplant into a person and then it's producing the insulin, then you've solved the problem. What else you could do is, rather than transplanting the whole pancreas, the islet cells, that's the cells that are specifically involved in production of insulin, can be transplanted. And so these are surgical modalities in the treatment or management of diabetes. As a patient, what is your role? Diet. Of course, it's important to note that a healthy, balanced diet is crucial, and that's the role where the dietitian comes in to give specific advice on what to eat. Exercise, always important to mention. It has to be tolerable exercise, and please speak with your doctor before getting involved in that. Self-monitoring will be helpful. Usually, it will be helpful for you to have your own glucometer. In other words, the machine that you can use to check your own glucose level and keep a record. It's important that you pay very close attention to your feet, because of the diabetes, patients are predisposed to developing peripheral neuropathy, which damages the nerves. And because the nerves are damaged, when they have an injury, may not even know and develop an ulcer. I would make a video on diabetic foot ulcer. And then the eyes may also be involved, so eye screening, very important. And then please pay attention to your urine. If your urine is foamy a lot, it may be an indication that the kidneys are involved, and that is really very important aspect to pick up very early so that it can be managed. What are the complications? Now, diabetes is not just an issue of sugar. It's not just an issue of getting the blood glucose control. Yes, that is the core issue, because so many things will go wrong if the glucose level is not adequately controlled. It will definitely have an impact on so many organs. For example, the heart, where patients can have a heart attack or myocardial infarction. The brain, where a stroke can occur. It could also affect the kidney, resulting in kidney failure. It could affect the nerves, resulting in peripheral neuropathy. The eyes can be involved, causing what's called diabetic retinopathy. It could affect the mouth, the gum, causing gingivitis, which is inflammation of the gum. It could also affect the feet, causing foot ulcers, which, if not properly handled, can result in amputation. So what can we do to prevent diabetes? Very important to eat healthy, balanced diet, engage in exercise regularly, and maintain a healthy weight. There are other videos that I would consider working on. Gestational diabetes, which is diabetes occurring in pregnancy, diabetic foot ulcer, diabetes and the nerves, that's peripheral neuropathy occurring, what happens to the heart, what happens to the eyes, and then diabetic emergencies such as hypoglycemia, diabetic ketoacidosis, hyperglycemic hyperosmolar state, lactate. These are diabetic emergencies that could occur. So look out for other videos that would come after this. And if you've learned something, like, share, and subscribe. Thank you, and bye.